I just wanted to say thank you for registering for the webinar and coming along to listen to myself and Jason talk about ISO 45003 and also about FlourishDx and some of the tools that can help to support you with adoption of the standard. So my name is Sheila Lord. I work with Jason on the UK side with FlourishDx, a fantastic tool that we absolutely love working with. My organisation is BMR Health and Wellbeing, and we basically work alongside organisations to help you adopt this very systemic and data-driven approach to workplace wellbeing, aligned to 45,003. And I'll allow Jason to introduce himself for those of you that don't know Jason. It's probably very few now because Jason's actually garnering quite a reputation as a leading voice on psychological health and safety at a global level. So over to you, Jason.
That's the nicest thing you ever said about me, Sheila.
Just make the most of it.
Yeah, no, look, my background is occupational psychology. I've been working as a psychologist for 15 years, but for the last few years been, I guess, wooed over by technology and, you know, the impact that we can have at scale using a technology platform as in FlourishDx. So, yeah, really interested in systemic approaches to workplace mental health and how we can create working conditions that support people to flourish. So not just survive, but, you know, achieve an optimal level of well-being.
Fantastic, superb. Okay, so as it says on the tin, today we're going to be talking about a number of different topics. So I'm going to start off the discussions and talk really about the current legislation. I'm going to be talking today specifically about the UK, but I think Jason would agree with me that, you know, there's legislation in some way, shape or form across many different countries, isn't there, when it comes to psychological health and safety. We're going to look at an overview of the standard, and Jason's going to talk us through some of that. So as we start to go through, we're going to look at the health and safety framework in the UK. And in the UK, we have the Health and Safety at Work Act. And the Health and Safety at Work Act is very specific in terms of what it is that we need to do. We need to ensure, so far as is reasonably practicable, the health, safety and welfare of employees, and that applies to psychological health as well as physical health, okay? So the law is absolute, okay? And this is definitely what organisations have to do. We do physical safety really, really well, but when it comes to psychological safety, we're looking at health and welfare, that's something that gets omitted quite a lot. So the law says in the Act what it is that we have to do, and then the regulations go into the how we need to do it, okay? And the way in which we're required to do that in the UK specifically is to carry out risk assessments, information and training, okay, related to psychological health and safety. And then in addition, there are a number of best practice guides, including the HSE stress management standards, which look at some key areas of work that Jason will explore further as we go into that. And then we've got this further guidance, which is the absolute granular detail that we've got in relation to the whole frameworks, and this takes into account a lot of the best kind of practice recommendations, from the HSE stress management standards, it's from the Australian standards, isn't that, Jason? It encompasses the Canadian standards, and again, all of the stuff that we've seen published in the UK, the Mental Health at Work Commitment Checklist, the Thriving at Work recommendations, all of these different recommendations you will find are covered through 45,003, okay? And when we're looking at the size of the problem in relation to the UK figures, the number lost to work-related stress, depression, or anxiety. That's a phenomenal number, an absolutely phenomenal number, and actually up 12.8 million on the previous year. How long ago did I mute myself, people? How long ago did I do that? You're on mute now, Jason.
You muted, or Assad did, and someone did. Yeah, about a minute ago. We didn't miss much, no.
Didn't miss much. Okay, so I was saying 17.9 million working days lost to work-related stress or anxiety pre-pandemic in the UK. That was up from 12.8 million the year before. The stats for this year, or the next bunch of stats, I think, are due out in October of this year. Who knows where that number is going to go? Okay. Now we have a number of current approaches that are typically followed. I know certainly in the UK, Jason, I'll let you allude to whether that's similar in Australia, but we currently look at approaches that consider mental health first aid. So we have MHFA, we have EAP, we throw in some exercise classes, we throw in the nutrition workshops, we have the fruit bowls, the wellness apps, the yoga classes, the meditation, and the mindfulness. So all of these are familiar things that, things that we'll all be familiar with if we're running workplace wellbeing programs. Now, the problem with a lot of these is that they're predominantly person-centered, and they're really focused on a very reactive approach. So we're waiting until we've actually got a problem when it comes to mental health first aid and EAP. So we're waiting for an injury essentially to already occur. So they're less effective. And the more we've trended towards these approaches over the last kind of 8 years or so, the worse the problem's got. It's evidenced in the figures. If you look back at 2004, when the HSE first released the stress management standards, and those were very much focused around the risk, the work factors that can potentially contribute to workplace stress, it was one of the few times we saw a drop in the numbers. So the current approaches are not working. They are less effective, and we keep doing the same thing and expecting a different result, and the numbers are going up and up and up. So, we've had the COVID, we've got the pandemic, we've got all of these huge factors going on in the world at the moment. And we've seen a massive change in how we approach work and how we approach working patterns. And who knows what's going to happen and what the new normal of working looks like as we transition back to the office, to hybrid working models. So, there's a real time of change, I think, now. And I think if we don't make the right choices and we don't make change now, when are we ever going to do it? Which is why the timing and the release of ISO 45003, which came out on the 8th of June last month, I feel couldn't have been more timely. So, this is a framework that's been developed by leading practitioners across the globe over the last 3 years. It incorporates all of best practice. It's been agreed by, I think, was it 70 countries that have kind of had input and sign off onto this altogether, Jason? And it's got the potential to be a real game changer. It's international, it's voluntary, and it offers guidance on how to do psychological health and safety at work well. So I'm going to stop talking and I'm going to hand over to Jason to talk you through the standard and demonstrate how we can adopt the standard in a simple and effective way. Over to you.
Thanks, Sheila. So one thing I'll just mention is that the ISO standard is very much around the prevent harm pillar, if you think about the integrated model of workplace mental health. So if we think about mental health being a continuum ranging from illness to wellness to flourishing, most companies, I think, are already working in the mitigate illness field. If you have an employee assistance program in place, for example, so somewhere where employees can access counselling if they're distressed or have psychological or distress issues that they want to discuss, then, those sort of things would help people to deal with those things before hopefully they become a serious illness or, a long-term psychological injury. Some companies are doing more in the mental wellness space to promote flourishing. Often, as Sheila said, they could be things like fruit bowls and yoga, which unfortunately don't promote mental well-being in the best way. Some of you might have broadened that to incorporate more elements of positive psychology, so things like acts of kindness and gratitude and mindfulness and these sorts of activities, or even taking more strengths-based approaches in what you're doing as well, rather than deficiency-based approaches. So all those things can help promote flourishing. The piece that's often missing is this prevent harm piece. So what are we doing to create the right working conditions when people come to work, that they don't become ill just because of the state of the work environment? And I think that's really, what most health professionals, health and safety professionals, and people professionals, so people in culture, HR, want to achieve. We want people to come to work and actually, if work is designed and managed well, it should be a place that actually promotes good mental well-being, right? Rather than people becoming ill because of that. But as Sheila said, in the UK, in the last reporting period, which only went a week into COVID, it was the worst year on record in terms of work-related stress, depression, and anxiety. In Australia, in the last 4 years, and this is again pre-COVID statistics, we've seen a 50% increase in workers' compensation claims for psychological injuries. We had the worst year on record again pre-COVID, and we know with lockdowns and uncertainty, job loss, and all the rest, that's just going to exacerbate the stresses on people. Because stress is cumulative, it's not just the working environment that contributes to overall stress for an individual. It's not just the individual factors and genetic factors. It's not just the macro factors. It's the combination of all these things together that puts additional pressure on people and ultimately can lead to them becoming mentally unwell. And so really what ISO 45003 is seeking to address is this bit that's missing. What can we do from a health and safety perspective to really understand at the root cause what is causing people to experience work-related stress, and dealing with it at the root cause at the systemic level, rather than the popular approach, which is actually waiting for symptoms to emerge of that someone is unwell or distressed, and dealing with it largely at an individual level through the things of like employee assistance programs and counselling. So really, we're not saying that ISO 45003 should replace any of the things that you're already doing for employee mental health, but really it should supplement and give you more of an integrated approach to how you deal with workplace mental health. But it's the piece that's missing, and I think it's actually the piece that is most required if we're going to have an impact and actually protect the health and wellbeing of others. Now, if you're not aware of the ISO 45000 series, 45001 is the parent standard for 45003. It's the standard for occupational health and safety management systems. And 45003 was very deliberately chosen to be a child standard of 45001 in order to say, well, this really should fall under a company's safety management system. So traditionally, employee mental health has been seen as a HR issue. So again, that's where wellbeing initiatives come from. They're the ones who typically will manage the EAP provider. But what ISO is suggesting is we really need to bring the health and safety profession into this and start to bring in some of their skills around understanding and monitoring risks. They're not expected to be psychologists or HR professionals, but like they would with physical hazards, they would need to bring in external expertise, whether they, if you think about physical hazards, they'd bring in engineers or electricians or, ergonomists, human factors specialists. They'd bring in those people to deal with the physical hazards in the workplace. And, when it comes to the mental health risks, then, OD professionals, organizational psychologists, these sorts of people, once a hazard has been identified, these people could be brought in to mitigate the hazards. But I think the health and safety profession has some very good skills around understanding risks, measuring risks, monitoring risks, action planning around risks, including looking at the risk register and how this fits in with that as well. There's a lot of things that can be done. And 45003 is all about that. Now, one of the things that is really pertinent around ISO 45003 and most standards, so Safe Work Australia, for example, the HSC management standards, the Canadian National Standard for Psychological Health and Safety at Work. It's all the same. It's all about continuous improvement. It's not, hey, let's just, go through and identify hazards and address them, and then we're the most mentally healthy workplace ever. No, it's about, going through a process periodically of going, okay, well, what are the biggest issues that we need to deal with at this point in time? Really looking at, what is the low hanging fruit? What are the things that we can easily address right now in order to have the biggest bang for buck in terms of improving conditions to support employee mental health and wellbeing. And so with that continuous improvement approach, it's what we call the plan, do, check, act cycle. So planning in ISO 45003 is covered in clauses 4 to 7. The do section is under clause 8, check is under clause 9, and clause 10 is the act phase. But again, as I was saying, you don't just do this once. It's a process that you continually go through. And so that's something that we're really interested in supporting companies through the company People Diagnostics and through our product FlourishDx. It's how do you do that as easily as possible, as cost effectively as possible, and incorporating that into your normal activities as part of your safety management system versus this being like this whole separate thing that you do kind of, in isolation without it being incorporated into business as usual. Now, for any sort of initiative to be successful, you really do need leadership support, and that is covered in ISO 45003. And so if you look at clause 5 of the standard, and it's great, I'm not sure, Sheila, I think I saw the other day that it is actually downloadable for free now. I know you could view the standard for free.
You can view it online for free, the whole standard, and organisations of a certain size can download it for free as a PDF.
Okay, great. Yeah. So look, everyone has access to it, right? Like you said, Sheila,
Absolutely.
whether it's in viewable form or whatnot. But really, this kind of it really is a change management process. We're asking companies to fundamentally change how they support employee mental health, and so really you do need a high level of leadership commitment. And it's not just enough for leaders to get out the front of in front of a all hands or in front of the organization and say, hey, look, we think mental health is important. And we think we should destigmatize it, and people should put up their hand if they've got an issue, and we're going to make sure that you can get support. No, leadership commitment is more than that. So the first thing we need to do is, if leadership is really supporting psychological health and safety at work, it is making sure that you have the resources available to do this effectively. So we need budget, like how much this is actually going to cost, how much time is going to be required. Do people actually have the time to do this? So I don't think it's good enough to say to people who are already busy, health and safety professionals, HR, OD professionals, and say, oh, here's another thing that you need to do, and we're not going to give you additional resources to be able to do it. It's just expected that you'll incorporate this as well. That's not good enough. If leadership is really interested in workplace mental health and adopting something like the 45003 standard, then they do need to make sure that the people that they're charging with leading the implementation of this actually have the time and resources required to be able to do this. And I would not suggest embarking as if you're an internal person within an organization on any kind of risk management, psychological health and safety initiative until you make sure you do have that leadership support. The next thing is we really need to make sure that it's integrated into policy. Sometimes there's some really nice words spoken around workplace mental health and the importance of this. But often they're done in silos, or they're just done as activities every now and again. They don't have any legs long term, however, because there's no policy that's around this. So really, what you should be doing at the very least is incorporating psychological health and safety into your health and safety policy. So you should have a commitment there from the organisation that there will be periodic assessment of psychosocial risks. There should be, resources allocated towards doing this effectively. And at the very least, employees should be given access to resources to understand the key psychosocial hazards in the work environment and what they can do to protect their own mental health and those of their colleagues. The policy is not around, we're going to make an EAP available. And, if people are distressed, we can, they can access that. That's great. You know, it's a nice add-on. But if it's a health and safety policy, it's like, how are we preventing people from becoming harmed in the first place by having, you know, healthy work conditions that, you know, don't put people in harm's way and create psychological injuries. Some companies do choose to have a separate mental health policy or psychological health and safety policy. I think that's a lot of duplication, and again, kind of isn't as strong as incorporating it into your psychological health and safety policy. Oh, sorry, your health and safety policy. Another way that leadership need to demonstrate commitment is that roles, responsibilities, and authorities are allocated. So who's going to lead this project? Who are the people that need to be involved? What's the competence that's required? And we're going to make sure that people are trained up and actually understand this. So we're actually working through some quite large organizations at the moment on understanding the competency requirements for people at different levels, you know, whether they're health and safety professionals, whether they're HR and OD professionals, whether they're line managers, and also employees, you know, what are required at all those different levels, and making sure that they're trained up in terms of, you know, what is psychological health and safety, what are psychosocial hazards, what are our responsibilities, and how are we empowered through different resources that we have available to us to create, you know, a healthy and safe work environment. And then importantly, there needs to be consultation and participation of workers. Unfortunately, one of the things I often see as a tick box exercise to say, oh, we've consulted employees about working conditions, is the annual employee engagement survey. So some people will say, oh, we understand the psychosocial hazards that are in our work environment. We've run this survey. It's once a year. We understand about things like workload and autonomy and, you know, control and relationships, and great. Now, unfortunately, with these employee perception surveys, you know, we're really getting a understanding of what the work environment is like from the design or management of work. And then we are generally making assumptions about the level of risk that's involved. A good example of that would be something like workload. Now, traditionally, when we look at things like workload and we use employee perception measures, we'll ask questions like, no, I have to work very fast, and we get a level of agreement or level of frequency that happens. I have to work to deadlines. Now, for some people, they wouldn't have it any other way. You know, they love to work fast. They love to be busy constantly. And if they're not busy, that would actually be a bigger stressor for them at work than, you know, if they were really, really busy. And another one would be job control or autonomy. You know, sometimes there are people out there who want to check their brain at the door. You know, they don't want to have to think when they're at work. They want, you know, a high level of you know, direction in terms of what they do. But the problem is with when we take these employee perception measures like the employee engagement survey or similar things, like even the stress indicator tool from the HSE, Sheila, would be like this. Mm-hmm. We're assuming risk. We're assuming that these are unhealthy conditions, and if they are sustained, then these people will, you know, develop a psychological injury or an adverse stress, you know, response. But it doesn't take into account employee preferences. So really, when we consult with our workers, we really need to understand not just how is work designed and managed in terms of these different things, but we need to understand what is the level of risk and how much stress is imposed. And remember, again, that's not all stress is bad. You know, we need stress to motivate us, but everyone has that ideal amount of stress. So we really actually need to understand from individuals, you know, how much stress is caused by these different working conditions, as well as the interaction between different conditions, because often it's not just one stressor in the work environment that leads to someone having an adverse stress response, but it's the combination of a number of different stresses, and then take into effect, you know, individual stresses from home, as well as macro stresses from things, again, like the pandemic and whatnot. So really, I think often these kind of employee mental health practices, or those companies that are starting to incorporate more psych health and safety, they're really let down by not doing the consultation well. A lot of money and time, I think, is wasted on interventions that don't hit the mark, because they actually haven't really done the real good consultation work with employees to understand what are the hazards that are present and what are actually our key risks and what are the things that we should be prioritizing. Does that make sense, Sheila?
Absolutely, yes. I'm just looking at some of the comments in the chat, and somebody, again, you know, just reinforcing the piece about the consultation and participation with workers. You know, Dave here is saying, you know, he's told by people that when he's doing training, that the organisation from a management perspective or a leader perspective say they have X, Y and Z in place and employees are completely unaware.
Yeah, yeah.
Come across a lot.
Yeah, and I've seen that so many times myself, Dave. So yeah, often when you look at a company's risk register, they'll go psychosocial hazards. That's a risk. So to manage that, we've got the bullying harassment policy, we've got the diversity and inclusion policy, we've got this policy, we've got that policy, and that's actually considered to be their controls. It's actually not controls aimed at us like addressing the specific risk. It's like this broad risk of psychosocial hazards, and they're looking at policy level controls, which if you think about the hierarchy of controls is actually more of an administrative control, and really not where we need to be aiming at, which is like the elimination or job redesign, or engineering controls, if you like. They're going to be more effective than these policy level controls. But even just letting employees know, we have listened to you and we've addressed it by doing these actions, but more importantly, again, actually involving employees in deciding what is going to be effective to address this identified risk and not just assuming. And I think that, again, that's a deficiency of the annual employee engagement survey that I often see. Often it's HR, they have all the data and they go, oh, great, we understand now, what are the key risks. So we're going to develop all of these controls independently and then roll them out. And employees aren't actually involved. But if you're thinking about the risk management cycle, you need consultation at every phase. It's not just about identifying the hazards and assessing the level of risk that's present, but when you're actually controlling the risk, you need to involve employees in what is actually going to be the best and most effective way to address these controls. It's not, management or HR going and doing that independently. We need a high degree of consultation there as well. But what I'm saying here on this particular clause 5 is you can understand why we need leadership commitment to this. This isn't just something that health and safety or HR kind of do on their own. There is quite a fair bit of change in terms of how we do this and incorporate this into other systems like our safety management system for it to be effective. But there needs to be time available for everyone, right? It's not just the health and safety team or the OD and HR team. We also need employees to have time to participate in providing their perceptions and also providing input into controls and to identified hazards.
Absolutely. And again, there tends to be a bit of a trend here. Scott's saying, again, we've touched on this, organisations appear to be providing nice to have.
You've just muted yourself again, Sheila.
How do I keep doing that?
I have no idea. You're very special at this.
I'm not touching anything.
Probably Assad. Yeah.
I think Assad keeps muting everybody and then he keeps catching me as well. Yes, who was it earlier? Kelly raised a comment earlier that said that they use their EAP system to support their mental health first aiders. And I just want
and that's great. Yeah, and we actually, as many of the people here no doubt would be aware, we have our podcast, the Psych Health and Safety Podcast, and we had Emily Pearson on from the UK to talk about the safeguarding mental health first aiders. And I think that's a bit that's often missed out. Often mental health first aid is brought in as a control to address mental health risks in the workforce. And, let's have peers actually trained up on how to respond to people and support their colleagues, and they're not trained in a few days to be counsellors or psychologists, but how do we sit with these people and direct them to assistance? But these people then, when we bring in that control, often we're exposing them to a hazard. These people are, that hazard is vicarious trauma, actually hearing about other people's traumas and then bringing that, or getting drawn into that themselves and the stresses and the emotional reaction that can have. And often mental health first aid is seen as the control and we're like, oh, we're done. But we have to understand in risk management that when we bring in a control that we might inadvertently bring in another hazard. And the hazard that's often brought in when we train mental health first aiders is that we have this new group of people who are exposed to hazards, and we now need to control that as well. Absolutely. So it's really great that, if you are setting up a mental health first aid program and peer support program, that you have your EAP or some other support available to your mental health first aiders to support them. Yeah, that's fantastic.
Marvellous. Okay, I think, and then was just before we move on to the next bit, it was Mark that said, coming from a military background, there's still a struggle there to identify and deal with PTSD. So can kind of the standard and some of the tools that we've got assist kind of medical teams and managers in the military framework to identify gaps and implement improvements?
Yeah, and this is the thing, right? So we know that not all hazards can be eliminated. So obviously, some of the things that people are exposed to when deployed, can cause significant issues, including PTSD. And so really, we need to think about, well, if we can't change the severity, can we change the frequency, duration? What supports are we providing? What training are we providing to people and before they are deployed? And maybe even how we select people, right? So we have to think about all levels or times of the employee's life cycle. Are we providing the supports required in order to prevent a psychological injury? Now, ISO 45003 largely deals with the identification of psychosocial hazards and the mitigation of them, and return to work. So once someone has experienced a psychological injury, how do we return them back to work without that issue being exacerbated? But things like PTSD, you really need quite complex, well thought out procedures and practices in place to support the employee throughout their life cycle. It's really not just identifying hazards after the fact and dealing with it. We know, even just doing a desktop review would understand that in the military, people are at risk of PTSD. And there's quite a large, I'm not going to cover it today because there's quite a large body of research around what could be done in these sorts of situations to prevent PTSD.
Okay.
Great. So how are we going for time? So we've got an hour today, don't we, Sheila?
We have, yeah.
Yeah. Okay. So what I want to do is now talk about some of the next bits of the standard. In particular, I wanted to wanted to do in a little bit of a different order to what Sheila had. Where is my slide here? With what I wanted to do. Okay, yeah. So I didn't want to go through the plan, do, check, act phase clause by clause, but I wanted to talk about specific things. So I've spoken about the importance of leadership commitment. You're not going to get anywhere unless you have leadership commitment. Actually, the next free training course that we're going to roll out, so the first one we brought out was the foundations course, which I'll talk about towards the end. We then brought out a training course on how to conduct a psychosocial risk assessment. I'm going to talk a bit about that today. But the next training course is how do we create the business case and get top management support for this. So be on the lookout for that in August, because that will help you to get leadership commitment to psychological health and safety and for support for 45003. But what I want to do now is talk about a feature that we've developed recently, which is called the Flourish Factor, which is all about 45003. Really, the goal of FlourishDx, or one of the goals of FlourishDx, is to be the easiest and most cost-effective way for a company to adopt the standard. So I want to just talk through some of the main features that we have that support the standard around those different areas. So awareness, workforce consultation, risk assessment, and monitoring and improving. So to do that, I am going to share my screen. I'll just log into the system again. Just give me one moment. Any other questions that have come up while I do this, Sheila?
Not at the moment, Jason. We've covered them all at the minute.
Okay. Have you got any questions, Sheila, while I do this?
No, not at this stage, Jason, no.
Okay, not a problem. Okay, so the Flourish Factor, I've got to say, is actually more the work of my colleague, Joelle Mitchell. Joelle Mitchell's an organizational psychologist. She is actually our ISO expert. So when you look at things like our ISO 45003 Foundations course, Joelle actually did the month or two of research regarding looking at 45001 alongside 45003, really working out how they talk to each other and really what are the specific requirements of 45003, and then writing all the scripts. So all I had to do was read the teleprompter on the day in order to get all the content done. So Joelle is also the main person who's behind what we call really interesting conversation. I noticed in the chat, I noticed Karen mentioned about mental health first aiders would look direct to our EAP provider. So she feels that they're not quite the end of the process. If we think about the integrated approach to workplace mental health, it is really important to have those things in place around the mitigate illness. So if we identify that someone is in distress or in need of, professional assistance, then, that's actually a good element to have in place, as is the well-being promotion activities that we do in the workplace. However, mental health first aid is again about reacting. It's like, how do we identify that someone's not doing well? And then we're directing them to assistance. What is fundamental to 45,003 and the psychological health and safety approach is understanding the working conditions that are actually leading to people having long-term or extreme levels of work-related stress and dealing with them at the source, rather than what mental health first aid and an EAP would do, which would be dealing with the individual and the symptoms. So it's all of these things are required, right, in part of in terms of a holistic, integrated approach to workplace mental health. Okay, the piece that has been missing for a long time, however, which is why ISO 45003 was developed, was to provide more guidance around how do we take a health and safety lens and a risk management lens, and really improve working conditions. So yeah, sorry, I will get back to sharing my screen now. Okay, so hopefully that gives you more context, Karen. So yes, they're not quite the end of the road, but they're still in that mitigate illness bucket. It's still in the reactionary bucket, whereas what we're trying to do with 45,003 is to get more proactive and really thinking about systems and the design of work as compared to individuals. So I was mentioning before that 45,003, the flourish factor, is something that Joelle spent a lot of time on, and really what she's been able to do is to break down each of the different parts of the standard into action steps. So you can see here when we get to section 5, for example, when looking at consultation and participation of workers, and you can see the ISO element that we're addressing here specifically is clause 5.4. So what we have with all of these 23 different sections is a very high level summary. There is a short video as well, and then the action plan. So what are the specific things you would need to do to adopt this part? So one of these things around participation of workers is giving people a shared language. It's no use trying to get them involved in psychological health and safety unless they first of all at least realize what a psychosocial hazard is, which, by the way, if you're new to this, is anything in the design or management of work that causes either constant or extreme levels of stress. So we're thinking about things like workloads, we're thinking about things like lack of autonomy, we're talking about poor supervisor or colleague support, bullying, harassment, sexual harassment, these sorts of things, right? So, but one of the things we need to do is to bring up the literacy of everyone. So one of the things I guess that we have been doing around workplace mental health for a while is trying to destigmatize it, which, bringing more language to understanding what mental illness looks like depression, anxiety and whatnot. But what we also need to do is to actually let people know what are the hazards in the work environment. And again, if you think about the physical health and safety lens, we need to let people know what are the physical hazards, whether that's, electrical hazards, whether it's manual handling hazards, whether it's, working at height, confined spaces. If people are in an environment where the threat to their health and safety has not been eliminated, then we need to at least provide some education on how to keep themselves safe. So one of the things that we have here is you could be taken to put together a employee e-learning program. So our e-learning program was developed fairly recently with a large multinational company. Fortunately, we're able to retain all the IP and be able to reuse it within FlourishDx. But what we've done is created all these different modules around mental health awareness, which not only takes people through the signs and symptoms and where to get help for common mental illnesses, but also how do you stay well, how do you optimize well-being using elements of positive psychology, but also psychological health and safety. So what is the employee's role in psych health and safety, and what are the common psychosocial hazards, and what can you do at an individual level to keep yourself safe? So each of these modules has a short video, which is between 2 to 4 minutes. We use animated video because we find it's more engaging than just text. People can work through this training either all in one go, which would take probably about an hour and a half with all the video content that we have here. Are you muting people, Sheila, as we go?
I'm just going to ask Assad to just mute everybody. You've got that.
Yeah, okay. So we can either do it all in one go, or we can drip feed, right? And say, well, look, really to start with, and this is where we generally suggest you start, is, focusing on the psych health and safety elements. one of the things we have definitely noticed is if you were just to provide training to employees who are really stressed because of, overwhelming work demands, or, bosses who, probably aren't the most empathetic, to put it nicely. And you go, oh, here's some mental wellbeing training for you, or here's a mental wellness app, it's quite patronizing for them. And so when we start to educate people about psychological health and safety and go, well, actually, it's actually a shared responsibility. And it's not just about you practicing better self-care to manage your stress that's caused by working conditions, but, we also need to understand from you what are the things that we could do to improve the working conditions to support your mental health and wellbeing. That's where we generally start in terms of raising awareness. So just remember, when we talk about raising awareness from ISO 45003, it's not what are the symptoms of depression and anxiety and where to get support. That's great. But really what we're talking about here is getting everyone to understand what are key psychosocial hazards and what they can do to keep themselves safe, or report hazards, or, what's their involvement in terms of the risk management and consultation process. The next part of ISO 45. Oh, sorry. As you go through here, what you do is you check these things off, and then what you'll notice is that your Flourish Factor score will go up over time, and the Flourish Factor score then becomes a measure of the maturity of your psychological health and safety management system. So FlourishDx isn't just a survey, it's not just an e-learning platform, it's not just a mental wellbeing app, but really together combined, it is a psychological health and safety system that helps you to adopt all of these elements of 45,003. But the next part is we need to identify psychosocial hazards. And as I mentioned before, when we're talking about leadership commitment, the typical ways that we understand psychosocial hazards using employee perception surveys, for example, have a lot of downsides, or they don't really get to risk. We get a good understanding or some perception of work environment, but we don't really understand the risk that's present to people's psychological health. So what we've been thinking about is how do we do that, and how do we do that efficiently? Because, from an operational perspective, you don't want employees having to do a 30-minute survey. And, we don't want to also, if you think from the health and safety person's perspective, we don't want to only be collecting data once a year. Because a lot, as we've seen in the last 12 to 18 months, a lot can happen in a year, right? In terms of the hazards or how quickly workplaces can change. So how do we get a good cadence of data around how people are tracking, and what are the key psychosocial hazards that are present that we might need to address? So one of the things that we've developed is what we call the Wellbeing check-in. And many of you would have seen a Wellbeing check-in before if you've used other mental wellbeing apps. How ours is different is, after we ask people how they feel, so that will be on a sliding scale between angry and stressed up to happy and joyful. When we ask them the next step, and this is very common in wellbeing assessments as well, or check-ins, it's not just individual factors that we're interested in. We're also interested in any workplace factors that may be contributing to people feeling positive or negative. So again, you can see here some of the key psychosocial hazards like job security, interpersonal relationships, co-worker support, bullying, harassment. They're all covered here. People, for their own self-reflection, create a journal entry as well if they want to, monitor some of the things that are affecting their mood. How that is really useful from an employer perspective is at an aggregate level, and we do provide this information and protect anonymity by only allowing results to be available once 8 people have responded in a reporting period. And we don't report back who has responded in that reporting period, but we can see how many people have, as you can see here. So you can see the overall trend. Now, how are people rating themselves on the check-in? And you can create organizational filters so you can see if it's happening in a specific location or a department, for example. But this is the interesting bit. What we've done is broken down what are the top reasons from an individual factor perspective, why people feel either positive or negative, and then from a workplace factor perspective. So this is where you'd actually focus all your health promotion activities. So you can continue to do things like, hey, let's get a nutritionist in to give us some information about how to, cook healthy meals, and, making sure that we get the right amounts of nutrients in our diet. Let's maybe get someone in to teach people about sleep, because from a individual habit perspective, it looks like people could probably benefit from those things. However, the work factors areas are the things definitely where you could focus your risk management activities and your work design. So we can see here, for example, that, job security, recognition, reward, they're the 2 biggest factors. Now, this doesn't actually tell you the level of risk that's present. This tells you when people are feeling in a negative state of mind, that these are the things that are the main reasons that the individual is self-selecting as, contributing to that. And if we go to the table here and we look at negative reasons here, for example, we can go by work factors. Again, you can see job factors, job security has the biggest count. What we then need to do is then assess the level of risk that's present. And we have what we call the work factors risk assessment tool, which we actually believe is the first true risk assessment measure that's out there. It goes beyond just employee perception surveys. We're assuming risk and actually getting down to what is the level of risk that's present. So it's completely customizable. So the idea is that you wouldn't just, run a survey that is generic and we ask about 23 different hazards that may be potentially affecting people's work-related stress levels. It is going, well, let's use that information from the Wellbeing check-in to really narrow our focus for the next part. And by doing that, we can do a survey then in maybe 5 or 10 minutes, which traditionally, maybe you take 20 or 30 minutes, which if you're trying to get, leadership support and operational support for doing something like this, obviously much easier to sell internally a 5 to 10 minute survey versus a 30-minute survey. How that then looks to people when they go to do that is, again, a different way from what people would typically expect to do a assessment of psychosocial hazards. So what we do with each hazard is we provide a description of what this actually look like. So we're looking at low job control here, for example. So notice when we look at psychosocial factors, we're not looking at, understanding in relation to job control, for instance, if it's high or low, and then assuming risk. We're asking specifically low job control, so lack of autonomy. How much is this actually contributing to risk? So the way we do that, first of all, is to start with wellbeing impact. So to what degree is this factor causing you to feel stressed, overwhelmed, angry, or upset? And we think that's actually very important because not everyone will feel stress in the same way. So using a number of words to actually understand wellbeing impact and the psychosocial response, we think is important. And that can range from, no impact, in which case they could just skip to the next question and we won't ask them anything else, through to, extremely severe impact. Now, if there is an impact, and this is just in the last few months, right, that we're interested in, then we need to understand the frequency. So does that happen almost never? Or is that something that happens multiple times daily or somewhere in between? And again, duration would be 5 minutes or less up to almost constant. So this is, if you think about how we would assess risk of hearing loss, if people are exposed to noise, we need to understand these three things, right? We need to understand the severity. So how loud the noise is, how often does it occur, and how long does it last for when it occurs? And so really by asking questions around psychosocial factors like this, severity, frequency, duration, we can then get closer to actually understanding total risk. And at the moment, we are linking that to outcomes, including burnout and psychosocial distress, in order to then develop a predictive algorithm, which will actually give you a risk score. So the risk score that you're getting here, the total risk score, is actually related to psychosocial risk rather than like outcomes, as in, in terms of burnout and distress, versus just some theoretical, we're assuming that because workload is high, that we have a bunch of people who are stressed and may be likely to develop a psychological injury. Because what you want to do, and this is an approach within ISO 45003, is to prioritize actions based on what is the highest risk to individuals. And ordinarily, if you were to use an employee perception survey, you would need to do a lot of follow-up in terms of focus groups to really, get down to, is this a risk? Is it not? What is it best? What is the highest risk? What do we need to do something about? And so really what we're trying to do is to shortcut that process and really get to that risk score, which then enables you to get to the next stage of consultation with employees to go, okay, we've identified what our biggest risks are. Let's now really start to nut out what these are and how we're going to work together to improve it. So Sheila, I'm aware of time and I believe we're out, but so really, what we're trying to do is to really look at 45,003 in particular, these things I mentioned before, which is around awareness, consultation, and obviously building up language, and then doing risk assessment and then monitoring and improving. So use those assessments over time, right? Whether it's the wellbeing check-in, which can be done in it only takes 30 to 60 seconds for employees to do. So you could actually run that once a month to get a good cadence of data coming in. Or using the risk assessment survey, which we suggest could be done every 6 to 12 months in order to monitor your risks. And then obviously then the next phase would be acting again, going, okay, have we actually addressed the risk satisfactorily, or do we need to plan some other controls? Or are there different risks now that are the highest risk for us, or the greatest priority area for us to address? So again, hopefully you can see that what we're taking you through here, and particularly the role of FlourishDx, is to be a psychological health and safety system versus a one-off survey or a training program or a wellbeing app. Sheila, back to you.
Excellent, thank you, Jason. So Jason, we've had a couple of questions raised in the chat, which I think are very relevant. We've had Lizette asking whether the risk assessments are a legal requirement, and absolutely they are. Oh, hang on a minute, the chat's just disappeared. Where's it gone? 1 second.
Yeah, I think is it clause 3 of your health and safety legislation there? Is
clause
the
3
requirement
clause 3 and clause 5 of the regulations 1999, yeah.
Yeah, so clause 3 is around, you need to understand what are your key psychosocial hazards or any risks, and that includes psychosocial risks. And then clause 5 is to mitigate any identified risks. Yeah, so have your plan in place on what you're going to do to address these, and just having your risk register saying psychosocial hazards are a risk, and here's our policies to address that. Like I think David was mentioning before, that's not good enough. You actually need to be consulting with staff around what are we doing to address the specific part of this risk, not just work-related stress or psychosocial hazards.
Okay, so excellent. So Mark is been asking, he's saying there's lots of free workplace wellbeing services that offer bespoke whole organisation reviews. As been suggested, the key is influencing heads of organisations. An educational organisation is different to that of social care to financial care. Can there really be one approach? Basically, I think what Mark's saying is across industry, can there be this one approach?
Yeah, so the hazards will be different, and the context of the organisation will be different, and that's why clause 4 of the ISO standard is about understanding the organisation and its context. So it's actually a bit that a lot of people actually skip over, but it's really important to understand the different contextual factors that you need to take into account when adopting something like 45,003. But the principles of risk management and understanding, what are the key psychosocial hazards, and having, getting into action planning, addressing things based on what is the highest total risk, that is something that's universal. It's not specific to a specific industry.
Yeah. Scott's raising the question that some employees have no access to technology. So how do we reach out to those people?
Yeah, so technology is great when you have access to it. Obviously, that enables us to do things at scale and low cost, and be really time efficient as well. But you're right, if you don't have that, so manufacturing would be a good example of that, maybe construction where people don't have access to technology. In those sort of sectors, it's really important then to make sure we're thinking about the competency requirements again for different people, whether they be health and safety staff, HR staff, line managers. It really requires probably more time spent with them to bring up their competency and to understand how they can have discussions with employees, because you can do risk assessment through discussion as well. It's not going to get you to it's going to be harder to quantify, but qualitatively you can do your risk assessment and understand from staff. It just is going to take a little bit longer, and going to need to work a bit harder on getting people's competency levels up.
And Jane raises a question that I kind of come across a lot, and I'm sure you do as well, Jason. Some employees see questionnaires and surveys as just another imposition, especially when they kind of get survey fatigue, they're completing them, nothing happens. So
I blame employee engagement surveys, Sheila. The problem is that it's not surveys that are the problem, it's how surveys have been historically used within organisations. So there's a lot of surveying and not a lot of action. So you often see surveys done, and employees, there's no feedback loop. Employees aren't told, first of all, what are the main outcomes. It's not relevant. Often the results of the survey are reported at a global level rather than a work group level, which specifically with psychosocial hazards, can be very different from work group to work group, based on the individuals within those work groups. And employees aren't involved in developing the strategies to address the main findings of the surveys. It's decided at a management level or a HR level. So I hate that excuse of, oh, we've got
Yeah.
survey fatigue. It's not the bloody survey's fault. It's how they're used.
Yeah.
But I actually do see the demise of employee engagement survey, Sheila. I think they offer very little value. They're often attached to bonuses. So, they're used incorrectly, or people are incentivized, to answer in a particular way, which gives you highly inaccurate information. So I think we're much better off using something like a psychosocial risk assessment, which not only might give you, better information about, what are the main things that we need to address to allow people to flourish in our workplaces, but also meet your legal obligations as well. And employee engagement survey won't allow you to do that. So sorry to whoever asked that question. It's not the survey's fault. It's how they're used. Yeah.
Okay, and Amanda is asking, and this is a great question in terms of engagement rates. So and I know we have the engagement rates of bonus apps, which is one thing, but what kind of engagement rates are we seeing in workplaces with regards to this? And what are your thoughts? I have my views, but what are your thoughts on mandating the engagement, i.e. requiring employees to complete the risk assessments and the training?
Yeah, so this is the thing that I'm fairly opinionated about as well. First of all, I think we should be mandating it. Is what we're talking about is a health and safety issue here. This is not a wellbeing issue. So we need everyone's input in terms to understand the hazards that are present in the workplace and what we need to prioritize. If you have people opting out, or you have voluntary and you have very low levels of engagement in the survey, you're not really going to understand the hazards. In fact, the people who have time to do the surveys are going to be the people who aren't overwhelmed by workload, and then you're actually not going to get a good indication. So you really should be aiming for a high one. And to do that, you really need to get down to the work group level. So it's not just good enough to roll this out from global and go, all right, this is something that we're driving. This is again where you need to spend a fair bit of time thinking about building up competency across the board, particularly getting down to line managers. And making the line managers responsible, having a KPI for each line manager about response rates in order to because they're the closest to their teams, right? And they can be tapping people on the shoulder and say, you haven't done the survey yet. We need your feedback on this to be able to, make sure that we're looking after the wellbeing of people. Because if you leave it to voluntary and run it globally, you're going to miss out on all the people who, like I said, are just the people who do it are going to be the people who have time to do it and aren't probably stressed. So, or you get the opposite, and you have people who have an axe to grind.
Yeah, no,
so
absolutely.
You really need to be aiming for as close to possible as 100% participation, or at least a really good representation of the workforce. And the only way you're going to do that is to get down to the work group level and have line managers with KPIs for, at each work group level. But to help with that, the way you get engagement is that as quickly as possible, following the survey, you get into the feedback loop and you share with people, hey, at a work group level, this is what we found, and get the line managers with the support of HR and OH&S to go, all right, let's talk about it, team. This is what we found. Let's get into it. And what are we going to do together to improve it? And once people start to get into that process, because remember, you don't just do this once, it's continuous improvement. So you get into a periodic kind of assessment every 6 to 12 months. Once they start to see, hey, this is actually a bit different, and we know if we do this, there's actually going to be action taken, then you get higher levels of engagement over time.
Yeah, excellent. Well, I think that's most of the questions. Gavin's asked to elaborate on clauses 3 and 5 on health and safety. Gavin, if you actually have a look at the regulations, it's clause 3, 3A, 3B, and in there it states that the duty is absolute. It shall be done. Okay, so I couldn't recite it off verbatim to you.
You need Peter Kelly here, Sheila.
No, we do need Peter or Vince. Vince Butler.
Yeah.
Definitely Vince could recite that one for you. But I think unless I've missed anything in the chat and anybody would like to unmute themselves, I think we've kind of covered all of the questions. Following up from today, we will be sending you a follow-up email with links to the free training from Flourish that Jason mentioned earlier, which is the 45,003 Foundations course, how to conduct a psychosocial risk assessment. You will get your FlourishDx certificate of completion, and you will then also be on the mailing list to be advised and informed of new training courses as and when they're released by Flourish.
Can I interrupt you there, Sheila?
Of course.
Yeah, sure. I think it's really on the agenda right now, coming, with the end of COVID, and particularly those who are neurodiverse in the workplace and the psychosomatic issues that are faced by neurodiverse people in the workplace. I'm just interested in Jason's view on support and development of neurodiverse people in the workplace as regards ISO 45000, because obviously different brains approach things differently, and the way we understand risk, it's not just one box, one frame that we can reference that. So we've got to take an individual and a holistic approach to that. So I'm just interested in your views on how you would approach the format ISO 45003 to supporting neurodiverse individuals, Jason.
Yeah, Gavin, I'm not going to speak to that because I'm not an expert in that area. So my background's organizational psychology and more risk management. As I mentioned a couple of times throughout the webinar today, when we talk about employee mental health, we really need to think about a holistic integrated approach. And ISO 45003 is really more focused on working conditions that contribute to work-related stress and how we're managing the working conditions at that systems level, not the individual level. But it's not to say then we just forget about the individual and individual differences and preferences and whatnot. That is another element, but that's not necessarily the approach of 45003.
I think there's what speaks to me in that space is a danger that employers think, well, I've ticked the box and ISO 45003, but I haven't really created an informed environment for that particular individual.
Oh, you could say the same thing about mental health first aid, right? People go, oh, we've got mental health first aid, we've got EAP, we've ticked the box. Well, really, we need to be thinking around what are we doing around that mitigate illness area? How are we supporting people who are distressed? How are we promoting wellbeing? How are we preventing harm through understanding working conditions better and improving working conditions? So it's all of these things right together. And one of the things that, hopefully will emerge as particularly line managers become more aware of the psychosocial factors that can contribute to wellbeing is that there are individual differences. It doesn't matter if you're neurodiverse or if you're an individual who just likes autonomy or doesn't like autonomy. Everyone has different preferences and working styles. And so that's where job crafting can come in really helpful. And line managers understanding that they're going to have differences. I mean, what we typically do with psychosocial risk assessment is we understand where is the largest issue or what is the most pressing issue for the largest group of employees. It's the low-hanging fruit, right? But how could a line manager allow someone enough control in how they do their work based on preferences or neurodiversity in order that it's actually going to be well suited to them, right? And so that's a separate element, not necessarily the focus of ISO 45003, but it's things like job crafting based on individual preferences and neurodiversity would be definitely something that, line managers hopefully over time will become more supportive of and understanding of. But we've got a very low bar at the moment, in terms of understanding. I mean, most of the time we're talking about anxiety and depression when we talk about mental health. We've got a long way to go to kind of bring people's knowledge and competence up to the same level as how we manage physical health and safety.
Thanks for being very informative, and I appreciate your support in that matter, and hopefully things progress. Thank you.
Yeah, thanks, Gavin.
That's fantastic. Well, if nobody else has any more questions for myself and Jason, I just want to say thanks for taking the time to come and listen to myself and Jason today. I hope you found it informative, and please do the training. Doesn't cost you anything except an hour of your time for one video, 40 minutes of your time for another video, and the more you can kind of build your knowledge around this area and around the fact that mental health first aid and EAP are not the only piece of the puzzle. We need to build this bigger picture, and it's very specific and very relevant to your individual organisations and will vary, but the framework can stay kind of the same. So thanks for attending, and we look forward to catching up with you in the future.
Thanks, everyone. Enjoy your
Thank
weekends.
you. Thanks.